One of the things that I learned early from Dr. Tabar, who was the person in Sweden who did that two-county trial, and that was my first introduction to real quality mammography and how it should be done. But I learned that we needed to work together and you needed to understand the pathology. So immediately the first benefit was to work closely with the pathologist.
Dr. Rose and Dr. Sutton enticed me to go to a meeting out in California where Dr. Laszlo Tabar was speaking on mammography and sophisticated ways to diagnose early breast cancer. And to say that I got hooked by Dr. Tabar would be an understatement. And so we came back in late 1995 and determined we wanted to form a comprehensive breast center.
At the time that we started this format, we were really the only area in Houston, outside maybe the medical center itself, in which this was a routine sort of event of meeting on a weekly basis with all the different physicians involved with the breast cancer diagnosis and treatment planning.
It's important that when we find an abnormality, that the radiologist understands the pathology, knows what to biopsy, when to biopsy, and then can communicate that back to the referring physician, communicate it to the patient, and communicate to the pathologist what our concerns are.
I think the most powerful thing that we have been doing for close to 20 years is the weekly conference, and it's dedicated to women who are recently diagnosed.
And so it takes an element of commitment on all the different parties involved, but at the same time, when you see the benefit of that as far as our ability to do a much better job taking care of the patient, it's worth every second.
So it really means working together as a team, working with your breast surgeons, working with the pathologist, working with the radiation oncologist, the plastic surgeons, and we work as a team.